So good afternoon. We're all excited to be here today at the Hynes Convention Center vaccination site to mark the start of a partnership with FEMA to significantly increase doses and access for some of the most disproportionately impacted communities here in the Commonwealth. I want to give a quick update on the Commonwealth's COVID data. Yesterday, the Department of Public Health reported 1,464 new cases. We've now had 18,600,000 tests in total conducted here in the Commonwealth. 675 individuals are in the hospital with COVID, and about 159 are in the ICU. Hospitalizations are down significantly compared to where they were back in the early part of this year. That's in some respects thanks to the high rate of vaccination we've seen for older adults. There's always been a direct connection between age and how likely someone is to suffer serious health effects from COVID. But over the course of the last week, Massachusetts has seen more infections than in previous weeks, and the largest growth in recent cases has been among young people under the age of 30. This time of year, we're seeing most of our cases. This time last year, we were seeing most of our cases in older adults. I think it's fair to say that no one can let their guard down with respect to this virus. It's still far too early to declare victory, and we have more progress to be made, especially with respect to vaccinations, which is why places like this are so important. Now, 80% of our residents over the age of 75 have received the first dose, which exceeds the national average of about 73%, and that helps drive down hospitalizations and cases for this particularly vulnerable group. With respect to vaccines, over 1.3 million individuals in Massachusetts are fully vaccinated at this point, and another 2.2 million people have received their first dose, and that includes the folks that got a single dose of J&J. We continue to lead the nation in administering vaccines to our residents. We are the leading state in both first doses and total doses administered among our peer states. That would be those 24 states that have more than 5 million people. And we're in the top 10 states overall for first and second total doses administered. There are over 200 public vaccination sites available in Massachusetts, and we've continued to ramp up our capacity to be able to handle additional doses from the federal government when supply increases. This week, the Commonwealth received 382,000 total doses from the federal government. That included about 215,000 doses of Pfizer, first and second doses, and 137,000 doses of Moderna, first and second doses. Those numbers also include a one-time shipment of about 30,000 vaccines for J&J for providers, and about 10,000 J&J vaccines have been set aside for the homebound vaccination program we announced last week. An additional 252,000 doses are being sent to community health centers, pharmacies, and the Community Vaccination Center program by the federal government. This week, doses from the state allocation are being distributed in the following manner. Mass vaccination sites are receiving 106,000 doses. Health systems and healthcare providers are receiving 133,000 doses. Regional collaboratives and local boards of health are receiving about 85,000 doses. Mobile clinics that support long-term care facilities, congregate care, affordable and low-income senior housing, and homebound individuals are receiving about 15,000 doses. Pharmacies, as I said before, are receiving about 152,000 doses through the federal retail pharmacy program, and an additional 13,000 doses through the state allocation. And between state and federal allocations, our community health centers are receiving about 87,000 doses. And this week, we will also see a significant increase in doses to ramp up at this mass vaccination site here at Hynes Veterans Convention Center. The Community Vaccination Program, which is a program behind the mass vaccination site, is receiving 42,000 doses directly from the federal government. We'll take every one we can get, right? We're grateful for the support of the Biden-Harris administration and FEMA in designating Boston for a pilot site, and for the strong advocacy of the Massachusetts congressional delegation in supporting our application. I want to thank especially Senator Markey and Congressman Lynch for being with us today. For the next week, the Hynes Convention Center mass vaccination site will have the capacity to administer 7,000 doses a day, with 6,000 doses being provided from the federal government on top of the 1,000 doses the site currently has daily from the state supply. The ramped up capacity will officially start tomorrow. Training's going on right now, and for the federal personnel who've come on board to support the program. And this site will continue to be open to the public. And as with all mass vaccination sites, residents seeking an appointment can continue to pre-register for an appointment at mass.gov/COVID vaccine. There will be no disruption to the appointment or booking process during this expansion. We'll also be working to conduct outreach to the surrounding community to help vulnerable residents sign up for appointments. The Hynes is easily accessible by public transportation with major bus routes, the Green and Orange Line, and the commuter rail all nearby, and free parking for 2 hours is also available. The Commonwealth will also be using part of these increased doses to set up mobile vaccination units in Boston, Chelsea, and Revere. We'll have more to share on that program soon. The expansion will also help our administration advance our commitment to equity in the vaccine distribution process and build on the efforts we currently have underway. We've announced over $30 million for vaccine equity efforts targeting the 20 most disproportionately impacted communities in the Commonwealth, and we're launching a door-to-door public information campaign led by Archipelago Strategies Group and Healthcare for All to help residents sign up for appointments and address questions people may have and barriers people may have about getting vaccinated. We also have, as most people know, a several million-dollar public awareness campaign that's focusing on trust in the vaccine, especially for communities and people of color. The Department of Public Health launched a community liaison program to provide liaisons to each of the 20 communities to identify barriers to vaccine access, such as transportation, language barriers, and registration issues. And these liaisons will work with municipalities directly and local boards of health to identify barriers and to create community-based solutions to build residents' trust and confidence in vaccine safety, overcome hesitancy, and increase vaccine uptake in these communities. We have a lot more work to do to reach vulnerable communities, but we have made progress. Over 20% of our Black residents have received a first dose here in Massachusetts, which is more than double the national average of 9%. And 13% of our Latinx residents have received a first dose, which is well above the national average of 7.3%. We'll continue to build on the efforts we have underway to make sure that every person in the Commonwealth who wants a vaccine has access to one. And this expansion here at the Hynes in the heart of Boston will certainly help us achieve that goal. Now, while we're making great progress on vaccines, we can't let this progress give us a false sense of security about the fight against COVID being over. COVID is still a serious, highly contagious virus with all sorts of new variants that are making it even more challenging. Vaccines are crucial to getting us back to normal, and we're very much on the way there. But in the meantime, everybody has to remain vigilant against the virus. We can't let our guard down now when we are so close to getting everyone who wants a vaccine access to one. Please keep following all of the public health guidance that's been in place for over the past year. Throughout the pandemic, our administration has issued guidance to stop the spread of the virus, and we've continued to monitor the spread of the virus, and we've continued to update and adjust our restrictions accordingly. Massachusetts still has a mask order in place. You need to wear a face covering when you leave your house. Gathering limits at private residences remain at 10 indoors and 25 outdoors, and you should all work extremely hard to keep informal gatherings small. Businesses like restaurants and other indoor entertainment venues have reopened, but they all have sector-specific public health protocols that they must follow to keep customers safe. And between the folks at the ABCC and our colleagues in local government, there are many inspections constantly being put forth to make sure people are complying with the rules. Massachusetts has some of the strictest COVID-19 protocols in place, and they're there for a reason, and we need everyone to continue to follow them and embrace them. People in this Commonwealth have done a tremendous job of battling back against this virus, but we all need to dig in a little deeper for a little longer. If we all do that, we can continue to move forward and get ourselves back to the point where life will feel a little more like it did before the pandemic. But it's important for everybody to continue to wear face coverings, to limit your interactions with people outside your bubble, and to engage in physical distancing. And get tested if you feel sick or you think you've been exposed to COVID. Testing is free. There are hundreds of sites all over Massachusetts, and it's widely available. No one in Massachusetts who thinks they've been exposed to someone who might have had COVID or had COVID should have any concerns about their ability to get tested. There are sites in every corner of Massachusetts. Test results are turned around quickly, on average in less than 2 days. Please get tested if you think you've been exposed, and stay home until you get the results. Testing is an easy way for you to protect yourself, protect your friends, protect your neighbors, protect your coworkers, protect your families, and help stop the spread of the virus. Much of our success with respect to being able to safely reopen parts of our Commonwealth are because of the measures that we have in place and the fact that so many people here in the Commonwealth have abided by those measures and taken them seriously. But to continue to make progress, especially with some of the new variants on the ground, that means every single person still needs to follow the rules to keep everyone safe. Do your part to protect yourself, your loved ones, and our Commonwealth as we enter the final turn of this terrible fight against this virus.